everyone, today I wanted to show you some of the tricks that I use to get rid of foot cramps. So I'm going to actually be using this book, the Trigger Point Therapy Workbook, to show you some of the diagrams, and then I'm going to show you the same points on my own leg and teach you how to roll them out. All you're going to need is a ball. So you can use a lacrosse ball. This is a hockey ball. It has a little bit of give, or a recovery ball also works. I find the smaller ball for the feet and calves a little bit more useful because you can pinpoint areas a little bit easier. I'm going to be demonstrating with the smaller ball because, like I said, it's easier to pinpoint areas. So the first area that we're actually going to work is the calf muscles. So a lot of people don't realize this, but the calf muscles are actually extrinsic foot muscles. So they do control a lot of the foot movements. So if you feel cramps coming through your foot, often it's caused by tight muscles in your calves. The first points we're going to work are actually on the front of the leg. So if you want to check these first three pictures, of course I'm going to show you. The dark dots are the actual trigger points, and the shaded area is the muscle. So now I'm going to find those points. So the first one, we have this bone here in the front of our leg, and we're going to go a little bit to the outside of the bone here, on the outside of the leg. You might feel it with your fingers. If you find the trigger point and it's active for you, it's going to be tender and sore if you push on it. So mine is right about here, and I'm going to place the ball and turn my leg. This way I can control the pressure and I don't have to put a lot of force with my hand. So I'm just going to roll in one direction, so pressure's only going in one direction, similar to pushing toothpaste out of a tube. And I'm going to do probably anywhere from 8 to 12 slow rolls on each area. Then I'm going to come up and move the ball a few inches down, and that will be the second trigger point in that area. And I'm going to repeat the same thing. You could have trigger points all along that muscle, so it might be a good idea, if you have the time, to roll the entire length. You don't want to push so hard that it's excruciating. So a lot of people think that more pain is better, but that's not necessarily always true when you're foam rolling. So I think probably about a level 5 out of 10 on the pain scale is just right. I'll quickly go through the other ones. We're going to go to the front of the leg, but on the other side now. And you can see that it's there's a bone here. I'm going to go inside here on there and go downwards. This one, when I press it, I feel it in my ankle going into here. So I'm going to put the ball there, turn my leg, and I'm going to do those rolls again like I did on the other side. Just short little rolls, nice and slow, like we're pushing toothpaste out of a tube. Only going in one direction with the pressure, releasing, and then going back down. Then I'm going to move the ball again a few inches down, and you'll find that same place. The ones lower down sometimes you can do with your thumbs, but I find that my thumbs get tired, so I prefer to use the ball. And same thing. If you're using your feet and your ankles a lot, this one here is probably pretty tender. You don't want to push too hard on it, and those muscles work to help stabilize your ankles. So if they're tight, you're definitely going to feel it lower down in your feet. Quickly go through these ones because they affect the ankle. and the heel, and then I'm going to show you the ones on the back of the leg that affect a lot of areas in the foot that are not all shown here. So I'm going to show you some of the ones on the outside of the leg. These are your peroneal muscles, so they are kind of ankle stabilizer muscles. The first one is higher up. You're going to go down from the knee and to the side of that shin bone here, and you're gonna probably find it with your thumb just by pushing in. It's gonna really be kind of sore, or just feel like when I push it, I feel it right here in my toes. So you know that's where the ball's going to go, and like I did before, we're just going to do 8 to 12 rolls in one direction. So that's the general rule of thumb. We roll all spots for 8 to 12 rolls as if we're pushing the toothpaste out of the tube. So pressure going in one direction and then releasing and then continuing. So I'm just going to follow this muscle down and roll the entire length of it for check it for trigger points and roll the length of it to try and release. But I'm not going to roll like all of this at once. I'm just going to do little sections. So that. And again, 8 to 12. And notice how I'm not really pushing with my hand. I'm using the weight of this leg against my elbow to apply any sort of pressure into my leg. It's easier, and it shouldn't be as much of a workout, because then you wouldn't be able to keep the muscle relaxed. And we would ideally like it to be relaxed while you're rolling it. So that covers the points on the outside of the leg. I would go down all the way to just before the top of the ankle bone. So it starts to get hard here, and I would stop before I hit that point, so about here. So I would roll all the way down. Now for the back of the leg. So I'm going to show you a few points on the calves. The first point is on the inside of the calf and kind of to the side. This one, sometimes when you get this trigger point, you feel it in the arch right here. So you can use your thumbs, or again, I like to use the ball, but once you hit that point, you're going to feel it. Either you'll feel it like a weird sensation in your foot, or you'll feel like it just hurts and it's not comfortable. So just rolling, and again using gravity mostly to do the work, because I'm not trying to force down with my leg. I just let the weight of my leg do the work for me, or I apply a little extra pressure by pushing some of my weight from my arm into my leg. So that point was here, and a few inches down, we're going to hit a second point in the same muscle. This one here, same drill, 8 to 12 rolls, and then we're going to do the same thing for the other side. So a little bit down towards the outside. I'm going to roll that 8 to 12 times and then move a few inches down here. I'm going to show you one more point. It's the soleus, and it's at the point where when you flex your calf, it makes like a little, I'm going to say a bum shape, and you're going to find the point where the kind of W part comes together of the muscle and just go right below it, and that's where that point is. You kind of push in there. This one's a tricky one. It really affects, you'll feel it all the way down the back of your ankle and into your heel. So some people with plantar fascia or fasciitis should roll this one. So I'm going to be like this, and if I want extra weight, I'm just going to kind of tilt my weight forward and control it. If I don't need the extra weight, I can keep my bum on the floor and just roll the small rolls back and forth. One final point, and that will conclude our video for today. It is a little bit higher, but kind of in the same place. But but I don't use my ball at all. All I do is I take my thumbs and I grab my calf and I dig my thumbs in. I don't rub back and forth or anything, I just push in and release. Push in and release. And I go all the way down and then all the way back up a few times. And for me, at least, it's tighter when I get to the bottom, but it depends on the person. It might be tighter at the top or at the bottom. All right, so that's what I do to relieve foot cramps. Notice that I didn't even touch my feet because oftentimes foot cramps are caused by tight calves. I hope you enjoyed the video, and if you did, please hit the like button at the end and subscribe to our channel. Thank you.